Good afternoon, Facebook. It's Friday afternoon. Thank you all for joining in so that we can talk a little bit more about COVID-19. I also want to touch on the budget today. I don't know if any of you watched the budget hearing this morning, but we'll touch a little bit on that. And then, of course, we'll take your questions and try to respond to as many as we possibly can. So, as of right now, in the city of St. Louis, there are 972 cases. Unfortunately, confirmed deaths in the city of St. Louis, there are 46. Now, take that along with those numbers, along with St. Louis County's numbers, which are 2,653 confirmed cases, 117 deaths, St. Charles, 516 confirmed cases, and 26 deaths. So the long and the short of that is about, I'm adding this in my head right now, but about 4,000, a little over 4,000 cases just here in this three county area, city, county, and St. Charles. And that compares to 321 cases in the whole state of Missouri and 218 deaths. So we have the vast majority of the deaths, and we have close to 2/3 of the cases in the state. That's not new information. That's been pretty consistent for the last couple of weeks. So yesterday in our region here, there were almost 700 people who were hospitalized, 694 to be exact. That was up 9 from the day before. What we're seeing with these hospitalization numbers is they go up and down a little bit each day. So I think it was Monday or Tuesday, there were 684, then there were 750, then there were 685, now there's 695. So we're seeing this hover around 700 for the last few days in terms of number of people hospitalized. The other thing that we're seeing is that the number of people that are in ICU hovering around 180. Again, the number's 173, 196, 185, 170. So, hovering around there. And then, unfortunately, 133, between 130 and 140 people on ventilators. And that is an extremely serious situation. I do want to mention that one of our police officers who had COVID-19, and it's been all over Facebook. I'm not going to name any names, but he was very, very seriously ill, and he's being released from the hospital today. So I just have to, say thank you, prayers, good thoughts, positive thoughts, and himself and his family, of course. I don't know if that will actually be on the news or whatever, because I'm not going to disclose any personal information to you. I'm just saying that we're all very thankful for that. We know that our first responders, our police officers, firefighters, EMS workers, paramedics, we know that they are on the front line of dealing with COVID-19 every day. And I'm just thankful, very thankful that this police officer is being released from the hospital today. I'm sure he still has a ways to go, of course, but it's been a long road for him, and I'm very thankful for that. I hope you all will join me in just, that little bit of good news here today. What else? The budget hearing this morning. I talked a little about the budget on what day? Wednesday, I guess it was. And very, very sobering budget, very austere budget. We are having to cut a lot of things that we wish we did not have to cut. We're basing it on our best guess with regard to how much our revenue is going to be down. We're looking at about $30 million for just this quarter that we're in right now, and possibly about $40 million for next year. And that's not the worst case. That's just, a bit of a middle of the road estimate. We know that the earnings tax and payroll tax this year, they represent 42% of our budget. in the city of St. Louis. So when you consider there are over 26 million people now who have filed for unemployment, and I get a notice almost every day from another company who says we're laying off X number of workers. So we know that our earnings tax is going to be down, and that's bad enough for us, but it's even worse for the worker, of course, who has gotten laid off or furloughed, hours cut, etc. So that's the serious situation that we have in the budget right now. This morning we had the public hearing. Of course, and I completely understand this. We had a lot of comments this morning about putting more money into the Affordable Housing Trust Fund. Last year we were able to we put $6 million in the budget, and they had about $600,000 left over from the year before. So the total they had available to spend in this year was $6.6 million. In our pared down budget, we are looking at funding them at the $5 million level. We are all this weekend looking at ways, this is the budget director's budget, of course, that he presents to us. We're all looking for ways to add more money to the Affordable Housing Trust Fund, because we know that when you have unemployment at these levels, that people have a lot of trouble paying their rent. We're hoping's the wrong word. We are planning to figure out how to do some rent subsidies, and those programs are somewhat tied up with the federal money that we expect to get. So we're thinking about housing certainly as a public health issue as well. So I just want to let you know that we're thinking about that day in and day out, and we're going to do absolutely as much as possible, because it's a humanitarian thing to do, and we want to make sure that as many of our residents as possible can stay on their feet. So that's kind of what I have to say, both about the numbers and about the budget. I could talk longer on the budget, but I won't. So those of you who, I'm already making your eyes glaze over, I know. So, but thank you for bearing with me on that. So are there any questions today?
Yes, Mayor. So many people are happy to hear about the police officer who's being discharged from the hospital today. One question about the city previously said about a dozen other employees of SLMPD were positive. How is everybody else doing among city employees who tested positive?
You know, I don't have a person by person report on that, quite honestly, because it's just their private information. But I am familiar with this individual because from social media and from his own family posts. And so today I do know that he's getting out of the hospital. You know, your personal medical information is not something that you have to provide or need to provide to your employer. So I know this is a spot of good news. And I do also know that some officers have recovered and completely recovered. So that's good news. But I think there are several who are still pretty ill.
On COVID-19, the pandemic task force had previously predicted that Saturday, April the 25th would be the region's peak or crest of overall cases. Based on our available information in the city, is that still expected to happen tomorrow?
It is still expected to happen right around now. You know, you never know where's the peak or even the plateau until you see the numbers start going down. So based on the best information that we have right now, yes, we are beginning to hit the peak, or maybe have hit the peak. We'll know as we get more days numbers.
Do you have specific guidelines for individuals in the community who have recovered from COVID-19, and any special precautions that they should take to prevent a secondary infection, or once you've recovered it, what should you do?
I'm not a doctor. You all know that. I think that there are folks who believe that once you've had it, that you have some immunity to it, but we don't actually have a lot of serology testing. This is completely new territory that we are in. And so I would just say to all of you, as well as anyone who has had COVID and recovered, to all of you, is that you really just have to treat every situation where you're around other people as if someone there has COVID and you don't want to be exposed to it. That's why it's so important that you wear masks. I showed you this last time, didn't I? For anybody who didn't get to see it, this is my new mask. It's got the city flag on it. It's really important when you're out to wear a mask when you're around any people at all, because that protects them from you. But similarly, if they are wearing a mask, you from them. So wearing the mask is really an important thing. And, we just have to continue with this social distancing and staying home as much as possible. And I know that you feel cooped up. I know that, you're stir crazy, all those terms. But it's just important to do that. The reason that, as bad as these numbers are, they could be a lot worse. And we were very, very worried that they would be a lot worse. So thank you all for following the guidelines, staying at home, social distancing, washing your hands, etc. Wearing a mask.
Have you made mask wearing mandatory in the city?
It is not mandatory, but it is very strongly recommended. So when you're out in your yard and there's nobody else around, no, you don't have to wear a mask. But when there's anyone else around, particularly if you're in a situation where you might encounter someone and not be 6 feet apart, you really should wear a mask. It's not that big of a deal, and you can wear the one that you buy or one that somebody makes. You can make your own. You can wear a bandana, a scarf. It's important that you do that.
When is the city going to reopen its tennis courts?
Well, we'll reopen the tennis courts when we reopen all the courts in our parks and probably the playgrounds at the same time. So I don't have a date for that. I'm sorry. It's nice weather for tennis for you tennis players, but it's gonna be a little while.
Does the city, or do you know or happen to know, which age range has been most significantly impacted by COVID-19 positive cases and people who have passed away from the virus?
So that information is on our website, and I looked at it yesterday or the day before. And in terms of pure numbers of cases, if I'm remembering this correctly, do you have that, Kyle? Okay, let's see here. Good. So that's what I thought it was. So it's people in their 50s and 60s in terms of pure numbers of cases. In each of those cases, I'm reading the chart right now, it's a little over 180, 185 people in each category who have been diagnosed with COVID-19. So that's the most, but there's also, let me say this, there's almost 100 cases of people in their 20s. There's 130, round numbers here, people in their 30s. There's another 130 people in their 40s. Then you get the 185 people in their 50s, 185 people in their 60s, about 110 people in their 70s, and 175, let me see, I'm reading the line here. In their 80s, we're 70, 75 people, 90s, about 20 people. Now that's in terms of number of confirmed cases. In terms of numbers of deaths, the most, all of these categories are fewer than 20 because the city's had 46 deaths. But so it looks like folks in their 80s, maybe about 15, folks in their 70s, about 10, folks in their 60s, about 10, folks in their 50s, eight or nine here. So that's just data for the St. Louis city. It's not for the whole region. So that gives I'll give Kyle back his what's that thing called? Tablet. So we've been saying all along, and the numbers prove it out, that older folks are more susceptible. And in this case, it looks like older folks is like 50 and above. Some of you might fall in that category. I fall in that category, certainly. And so, just have to be extra careful. So follow the guidelines.
What are some ways that people in the community can support our local restaurants and businesses who are struggling right now?
Carry out, carry out your food. There's a restaurant that I go to once in a while, and they're just so grateful when you do carry out a couple of different ones. Um, because they're all struggling terribly. So carry out, buy gift certificates to those restaurants. Be sure that even though you're carrying out, you give a nice tip if you can possibly afford to do that. And I think that's the best way to support your the restaurants themselves. And I will say, I believe there is a fundraiser for restaurant workers that, if I'm not mistaken, is tomorrow night. I'll find that and post a link to it. It might be next Saturday. That's the only thing I was thinking as I spoke with you. But so, we all want these restaurants to come back, and they're in a really tough time. And of course it's about the restaurant and the restaurant owner, but it's about the restaurant workers. It's about your favorite servers and the folks who work in the kitchen and folks who bus tables, and all of those folks are so severely impacted.
Is the DMV at City Hall currently open?
No, the Department of Motor Vehicles, where you can renew your license plates or your driver's license, it is closed because City Hall is still closed to visitors. And it'll likely be like that for a little while longer. In case your driver's license or your plates are getting ready maybe to expire at the end of April here, the governor did automatically extend all those expirations for 60 days. So you'll have time to get back in and renew your driver's license or your plates. And some of that you can do online. So I would suggest that you go online to do some of that.
One question about crime and the status of cure violence in the city of St. Louis. What is the status? Mm-hmm. How has it been impacted by COVID-19? And the city is not considering cutting the funding for the first year.
We are not considering cutting the funding for the first year. Fingers crossed with this crazy budget. I just spoke with Dr. Eccles about that. I think it was yesterday. And they have been trying to hire folks for the Cure Violence for the first location, which is in Wells Goodfellow. But it's been very difficult to reach out into the community. So with the stay-at-home order in place. So that's running a bit behind. Certainly we do need that. Violent crime is not down in our city. And it's a combination of things. Some other crime is down, but violent crime, assault first, homicides are actually up pretty significantly over last year. As of this morning, we had 47 homicides in the city of St. Louis. That compared with 38 the last year on this same day. So.
Whenever the city begins to reopen its buildings and parks and things like that, will there be professional cleaning and continuous sanitization of those facilities?
Yes, thank you for that question. There has already been professional cleaning of all the city buildings, office buildings, City Hall, 1520 Market, and there has also been, it's a fogger system which has a mist in it that sterilizes the area for up to 2 weeks. So we've had 2 rounds of that already, and we'll continue that process every 2 weeks.
What is something that someone at home can do to help our EMS, our first responders, fire, police, and things like that?
Good question. You can always thank them, when you see them out. Masks, but they actually have their own. They usually wear the N95s, the very serious masks. What can you do to help them? I think show your gratitude, show your appreciation. If somebody else comes up with a better answer to that during this broadcast, I'll certainly put it out there. Same for our police officers. These folks are on the front line every single day. And, the best thing you can do to help them, stay in and don't get sick.
How prepared do you think the city was for a global pandemic? And is this something that you saw uh, coming in your tenure as mayor?
No, I did not anticipate that we would have a global pandemic. You can fault me for that if you like, but I think almost no one anticipated a global pandemic. It has never happened, in 100 years. We were prepared, maybe luckily prepared in a couple of ways. One, we have a really good professional doctor as our health director. And so we didn't know we were going to have a pandemic for sure, but we knew that we needed a public health physician to run our health department and specialize in this. So that was a little bit of luck, but that helped us to be more prepared. The other thing, one of the things that he did when he got here, of course, I'm pretty sure he didn't know we were going to have a global pandemic either, is he began automating some processes in the health department, particularly contact tracing. So we do contact tracing for other illnesses, I'll say, for TB, tuberculosis, which we don't get a lot of cases of, but we do get some. It has to be very intense contact tracing for that. For STDs, it has to be contact tracing for that. So one of the things that Dr. Eccles did was to automate that. He uses a program, I think it's called Qualtrics, which really helps cut down on the personnel time to call everyone. Because if it turns out that, let's say, I hope this isn't the case, I'm just going to use it as an example, but let's say that someone you know who's close to you turns up to be COVID positive. Well, then if you've had any prolonged exposure to that person, you would be contacted, and you would likely be quarantined for 14 days. And during that time period, you would have to check in twice a day with the health department. You'd have to take your temperature. You'd have to answer questions. They'd give you the thermometer. They'd give you a lot of information. They'd talk with you on the phone. But then the check-ins twice a day is something that you would supposed to either go on your telephone, go on your smartphone, or go on your computer and record the information. Now, if you fail to do that, then they'll be calling you on the telephone. But that automated reporting in is what helps our health department do contact tracing in a very efficient way. And then the program, it's smart. It even kicks it out or turns it red or whatever it is for when somebody doesn't do it, so that it can be very quickly followed up on. So that's one of the ways that we do. I say we. It's Dr. Eccles and the health department who do this. His team does, in order to contact trace anyone who has been associated with or in a prolonged exposure to somebody who has tested positive for COVID-19. It's very, very important that we self-quarantine those folks and check on them for the 14 days so that they aren't possibly out spreading it in case they developed the COVID-19 virus.
All right, rumor control question. Is it true or not true that the city of St. Louis will not help an unhoused individual who has a felony conviction?
No, that's not true. That's not true at all. We are helping all unhoused individuals. Some do have felony convictions. Now, I will say this. There are some shelter locations that will take people with felonies and some who won't. But no, we are helping everyone who is unhoused. We have placed lots of people, close to 40 people, just in the last, I guess, probably 2 weeks by now. And we're going to continue to do that.
This is on the first responder, how you can help. Bobby is watching and says maybe somebody could buy them lunch and send it to the firehouse or police station.
Hey, Bobby, that's a great idea. Is that Bobby Duffy? No, I don't know, Bobby.
I don't know what
We don't know.
last name is.
Okay, we don't know Bobby's last name.
But it's a good idea.
That's a great idea.
Sam is watching. Do you have a tentative date for when the city's stay-at-home order will be lifted?
I don't. We are watching this data every day, day to day. We are working with the pandemic task force. We know that Governor Parson is lifting the statewide stay-at-home order really, it's lifted on May the 4th. That's Monday. So that's about 10 days away. Next week, we expect that the governor is going to put out some guidelines or under what conditions the order is lifted, because I don't think it's just, light switch on. It'll be light switch. It's like a rheostat, on a little bit. And this screen keeps jumping. Is there something we can, well, we're going to keep going. It looks like we got a little, I don't know.
It's this awesome Wi-Fi. Maybe.
It's the awesome Wi-Fi we have in the mayor's office, possibly. So at any rate, so we'll see what the governor's predicting or what his guidelines are next week. The other thing that we're doing is we're talking to industry groups. We're talking to businesses. We're looking at what other people are doing around the country. And in order to be able to open things up gradually, open it up a bit. And as I said, maybe somewhere recently, we hope that it's not like a champagne cork, where you're trying to ease it out, maybe just get the cork out real easy. And sometimes it shoots the kitchen light fixture out. We hope that doesn't happen. We really need for this to be a very gradual, progressive opening so that we can continue to test people, that we can continue to contact trace. And we hope not to see a spike up in the number of people infected with COVID-19.
There are two questions related to the states. You mentioned the May 4th. States stay-at-home order is about to be lifted in about 10 days. Why isn't the city aligned with the state and also doing May 4th?
Why aren't we all doing the same thing? That's a great question. 114 counties in Missouri. Some counties have one case. The city of St. Louis City County, and St. Charles, we have 4,000 cases. So we're just not all alike. We live in a very dense environment here in the city of St. Louis. Our own cases, 972 cases, 46 deaths. That's just a lot different than, I don't know, pick another county, Randolph County or Adair County. And so we can't all do exactly the same thing at the same time. More blinking on here.
It looks okay on the live feed.
Sorry. Okay, fine.
So the second question related to the state's stay-at-home order that's lifted on May the 4th. For businesses in the city, do they follow your stay-at-home order after that? And how will the city enforce that to make sure that everyone is not suddenly opening between May 4th and May 15th?
Well, the governor's made it very clear that this is up to the local jurisdictions. Some will feel that it's time for them to follow the state's order, and others who have many more cases like we do may say, well, it's going to be another week or another 2 weeks. We're going to continue to watch the data. So the orders apply in your own jurisdiction. So City of St. Louis orders apply to businesses in the City of St. Louis. Ditto for St. Louis County, St. Charles. You may have seen that this morning, well, I read it this morning. I don't know exactly when it happened, but Governor Pritzker across the river in Illinois, he has extended the stay-at-home order until May 31st in Illinois. And so every county has to figure out what to be done. Confusing. And one of the things that we are doing here in the St. Louis region is we are trying very hard to make sure that that at least St. Louis County and St. Louis City lift the order, have at the same time, have similar restrictions, have similar phases. And we're all thinking about that right now.
Okay, I think we have time for like 3 more questions. One viewer is complimenting the city for the new transparency portal. Can you speak to what information's on there? Why we decided to create that page?
So we created the page because, we are spending, sometimes I say we're spending money like we have it. We're spending money here because we have to. We have to buy the personal protective equipment. We have to buy tests. We have to contract for more beds for homeless individuals. So we have put that up on the website. Easy to find. Just go to the website, COVID website. You'll get to it real quickly. And right now it posts what had been spent, vouchered, I think is the word we used, through the 12th of April. We'll put up more next week. as we spend more money. And that's just sort of the first round. We haven't actually received any federal money yet, but we believe that we're going to. We're sure that we're going. Some controversy about what the amount will be, but we're spending the money and anticipate getting reimbursed, and we want you to know how we're spending the money. Most of these decisions that you see right now on the website are decisions that Dr. Eccles have made. They're very directly associated with medical needs and that sort of thing. But yes, we have a transparency portal up there. It'll be expanded. It'll get better. So feel free to check it out.
Sarah's watching. What do you think life looks like on the other side of all this? In other words, kind of what's it look like in your opinion?
Well, Sarah, I'm probably a lot like you are in a way. I'm really wondering, well, what does life look like? I don't think it looks like it did 60 days ago. I think it looks like masks. I think it looks like social distancing. I tend to be kind of a hugger. I think that's out, I except for maybe immediate family members, but handshaking is out. I guess we're doing the elbow, and even it's probably not 6 feet apart. I call it the chicken wing. I don't know if you guys like that or not, but so life looks different. I think you'll see in businesses. Obviously, you'll continue to see PPE, personal protective equipment in business. The screens, the plexiglass screens that you're seeing now at the grocery store and various places. I think you'll continue to see that. I think in offices and a lot of places, you'll see some A team, B team, or red team, green team, whatever you want to call it, and they might have staggered schedules so that the offices are not as dense. I read an article today or yesterday. It was kind of interesting. Open office environments are very popular now, where you got maybe a table like this one, you got 2 or 3 people with their laptops working at the same table. That might not be like that anymore, because it's just, you can't get the social distancing. So I think this is going to evolve. We're all going to participate in it. And so those are just some of the things that I foresee. And I'm sure you see those things as well.
Okay, 2 more questions. I lied. The stay-at-home order and social distancing restrictions that the city has enacted, do they apply to religious functions and gatherings? This person's asking because the Muslim community is now beginning to observe Ramadan.
They do apply. 10 person, no more than 10 people, socially distanced. It applies to churches of all faiths.
For the
churches, synagogues, temples, yes, it does apply.
Last question. It's kind of, because it's Friday, can it be a fun question?
Are there fun questions? Yeah, let's have one.
Good fun
There's
question.
a fun question.
This is from the very beginning. Aaron is watching and is asking, when this is all over, what's the first thing you're looking forward to ordering at Ted Drew's?
Oh, well, that's easy for me. Chocolate, banana, concrete. That's my favorite. Although I do like the peach. Also, peach is good, but chocolate banana is my go-to.
So then when do we get to go to Ted Drew's?
Just hang on a little longer, guys.
I think that's it. That's all the time we have for. So
thank you all. Really appreciate you, every single one of you. Those of you that are staying at home, observing the social distancing, washing your hands, wiping down surfaces. Thank you for doing that. Those of you that are homeschooling your kids, trying to work and all that from your house. Those of you who are going to work, and I know that's a whole lot of you that are going to work every day, police officers, firefighters, EMS, dispatch, healthcare workers, doctors, nurses, dietary, housekeeping, grocery store workers, checkers, baggers, folks who do the carts, folks who stock the shelves, I'm sure airport workers. So I know that a lot of you are working. A whole lot of our city employees are working because we provide essential services. We're still going to pick up your trash. We have to, we need to, we want to. And so thank you both to those of you staying home. That has its own stresses. I know on my Facebook feed, I see some of you are very creative, talented, and have some very humorous posts. Yeah. So I'm thinking of one that I saw last night. I won't go into it, but it was so funny. And Jacob thinks this is really funny. I don't think it's that funny, but I'll show it to you anyway. Let's see. So I don't know if you can see that. Probably not. But here, first of all, it's the worst picture of me in the world. Sorry, all, but we're all vain. The top of it says Missouri. Dad said we could go out. St. Louis. What did your mother say? Hang in there. We'll see.
That is funny.
I know. People in my office are getting the biggest kick out of that. I'm glad that they're entertained. Thank you all. Appreciate it. Have a nice weekend. Stay in as much as you can. Relax. Take a walk. And really appreciate all of you. Be back next week. Thanks.